Pleasure to see you here in Milan. What I will do in the next 10 minutes is to update you on some of the concepts that we use in our discussion. That's how science starts. What does the words mean? For some of you that will be something you know, but there are probably some new people in the audience, so I'll explain you a few words on what we do in the food and health domain, this famous DISH model, and especially also what a research infrastructure is. Let's see if this works. So I start where the project started 3 years ago, challenges in the food and health research domain. And if we look to that, then you see on the left side, for me on the right side, the agro-food sector in this slide, where there are a lot of public and private investments. We do a lot of research on food. And on my side, you see the health issue, where there's also, of course, a tremendous investment in science, public and private, in health. By the way, somebody we interviewed said it's not health, it's a disease system. I don't want to challenge you, but it's, in that sense, very curative. And we think that the challenge for the next years is to link what is happening in the food area and what is happening in the health area, because there are these tremendous societal challenges on nutrition and food-related diseases in this aging society. So it's therefore that we focus mainly on linking food with the nutrition and the health area. And we do this, if you do this linking, then there are a number of steps if you connect food and health. And Peter will elaborate that because you see every time this word DISH. It's an abbreviation that starts with the determinants of our food choice. Why do we buy? Why do we eat what we eat? Can we explain that? Then there is the intake. Do we know what people are eating? Somebody of a large company said a few weeks ago, I would like to develop products for the aging society, but we do not have data on what aging people in Europe eat and which nutritions they take. Then it's the status, what is the effect of your eating? How do we manage to measure the shape, the status of your body, of your... And then there is the health aspect, of course. How does certain ingredients or nutrition influence your health, or how does health influence your food intake? Peter will elaborate that. He's more in the food science than I am. But that is what we call the DISH model. And it was invented in the beginning of the project. At the end of the project, we would like to get rid of it, but everybody said this is a very good model. Please keep using it. Will do. So if we look to the challenges, I said already, if you look, most of you will know that, Horizon 2020, health, democratic change, well-being. Then there is in Europe the ESFRI, the European Strategic Forum for Research Infrastructures, for those of you who are not so well, do not know so well that area of research. And they also have on their agenda an issue that they say we need to connect this food and health area. If we look into the area, we see a number of developments. We see developments in genomics, in neuroscience. Our expectation is that in the next 10, 15 years we are going to learn much more on how our brains influence our food choice and what our food choice does with our brains. We also see a lot of trends in technology. We had a dinner yesterday evening and there were 2 or 3 people on the table with a smartwatch. Perhaps that's a biased sample, but they were measuring how much they walk today, and well, that happens quite well here on the Expo. But there are these things, and what can we do with that data? Can we better understand lifestyles, etc.? I did that here in a picture. Can we, of course, Apple and Google are working on that. Can you connect the health data that becomes digital available? Can you connect that with lifestyle data, with these smartwatches? But can we also connect it with food intake? And can we measure it? And can we convince consumers to make that data available to research in a research infrastructure, so that our scientists can do innovative research and also can prove if these things work, by the way. They work technically, but do they also have an effect on the obesity problem? So that brings me to the explanation of the word research infrastructure. which is essentially a center of knowledge. It's in the knowledge triangle of education, research, and innovation. If you look to the innovation side, then a research infrastructure is a thing that provides a unique research environment where you can do innovative research. There are all different type of research infrastructures in Europe. Some of you will be familiar with the domain of clinical trials, like in Krijin or other ones, but you also have the Collider in Geneva, of course, a very famous research infrastructure. So some of them can be hard infrastructures with a lot of equipment. Others can be much more virtual, where you share your data, for instance, over the countries, and they are linked to scientific disciplines. Then there's also the research infrastructure in research and education helps, of course, to elaborate the scientific communities, to attract young people to science, and in that say, build bridges between national research communities and the overall, let's say, European or even global research environment. And ESFRI is the European Strategic Forum that is working on this and looking to what should be supported in this area. So our outcome of EuroDISH is mainly a proposal. This milestone that we define here today, the Milano milestone, is a proposal to the ESFRI committee to take our ideas of this meeting here today on board and encourage the countries also to invest in that and to join the process that we start here today for probably the next 10 years. So then a few words on the project itself. Most of you will be familiar with European projects. So what we did is look how we could come forward with advanced and feasible recommendations on the needs for such a food and health research infrastructure, or infrastructures, plural. So that means, is there a need to develop new ones, or is there a need to integrate the existing ones? The answer on both is yes. That was the objective. And how did we do it? Some of you have been in our earlier stakeholder interactions. We did an extensive mapping in all these DISH domains. So some of the work package leaders are here. They went to great depth in seeing what is there, what are the needs, what is not there, what are problems. That led to a synthesis and in which we also look to the governance. It's not only a technical issue. Having people working together in Europe is also a governance issue. There are also big issues, of course, on the privacy of data, the ownership of data. And then we created a conceptual design and roadmap on which Peter and Karin this afternoon will talk in depth on what we propose. And that was, of course, supported by some casework and some methodological research. Which brings me, I think, just in time, to my last slide. I thank you for your attention. I hope that it's helped you to get a start with what a research infrastructure is, what we did, and where the societal challenges are. Thanks.